Although many people have registered for the vaccination, but there are a number of people today who received phone calls late this morning notifying them of the cancellation of their vaccination appointments with no new appointments being made. All those called had registered days in advance, and the list of recipients on given days were sent to inoculation sites around Bangkok prior to the first day of the mass vaccination of its residents. The number of doses provided was reportedly fewer than expected. One of the vaccination sites, which had planned to inoculate 800 to 1,000 people on its first day, was only able to vaccinate 500 people. Thailand kicked off its inoculation campaign on February 28th, with Public Health Minister Anutin Chanvirakul being the first person in the country to be vaccinated with Sinovac's Coronavac. Several days later, the Prime Minister became the first Thai to be inoculated with the AstraZeneca vaccine. Over the past 3 months, Thailand has inoculated less than 10% of its population, while news about the vaccine supply shortages and delays keep emerging. Notably, the page on the Department of Disease Control's website, which usually shows the number of people inoculated in Thailand, has been taken down. Last week, the first lots of the Thailand-made AstraZeneca vaccine were delivered to the Ministry of Public Health. The supplies are supposed to meet the amount of vaccine Thailand requires to cover 70% of the population. On the other hand, Prime Minister Prayut Chan-o-cha gave yet another assurance today that there is sufficient COVID-19 vaccines to inoculate those who have appointments this month. While admitting that for the time being, the demand for inoculation exceeds the doses available, he assured that every individual in Thailand will be inoculated no matter where they have applied for it. The Prime Minister stressed the need to reprioritize by allocating vaccines to those who are at high risk and offered an apology to people in other provinces for the delays due to the vaccine shortages.